Can you talk about the definition and how
Yeah,
you thought that should
it's
change?
very tricky to know. Are
Hmm.
you premenopause? Are you perimenopause? Are you postmenopause? Are you some other kind of pause? Where are you in this whole thing? And then it gets even more confusing because the standard definition is not helpful. Now, keep in mind that the definition of menopause is 12 months without a period. That definition goes back like 1,000 years, truly. And when you look at today's modern woman, that doesn't necessarily mean anything because we have roughly one third of the population that has had a hysterectomy. And keep in mind that if you have removal of your uterus, that does not mean you are in menopause. It's only if you have removal of the ovaries. So you have a huge number of women who maybe had a hysterectomy when they were in their 30s or 40s and don't get a period, but they're not in menopause. So that 12-month definition doesn't mean anything to them. And then you look at the women who, as you mentioned, may be using some form of hormonal contraception, such as a vaginal ring, like a NuvaRing, or maybe birth control pills, or maybe a progesterone IUD that is also going to stop them from getting a period. But it doesn't mean that they're postmenopause. And then we have the final category, which is women who have had a uterine ablation, women who have very heavy periods, sometimes have a surgical procedure where the lining of the uterus is actually destroyed so that they no longer bleed, which is a beautiful thing, but it doesn't mean they're in menopause because their ovaries are still pumping out estrogen. So my definition of menopause is a little clearer, and that's when your ovaries are out of business. They are no longer making estrogen and they're never going to make estrogen again. And that maybe because they've just naturally wound down, it's their time, or it may be that they have been removed, or it may be a consequence of cancer treatments such as chemotherapy or radiation. But the point is that when we talk about 12 months without a period, that's helpful if you're a woman who's having regular periods and then all of a sudden things stop. But it's not helpful for a lot of other women.
Okay, I've hit this point. Should I try hormone therapy now, or what's happening? Is there a certain time?
Yeah, well, so this is the thing. The short answer is whenever you're having symptoms. So often women are told you have to suffer for a year, or not use the word suffer. You have to have hot flashes for a year, be without a period for a year, or, fill in the blank, some kind of random idea of when they should get treatment. And my approach is as soon as you're having bothersome symptoms is the time to have the discussion about what are my options? Is it appropriate to start hormone therapy? Is it more appropriate to maybe do a low dose birth control pill at this point? It really depends on where someone is in terms of perimenopause, postmenopause. It depends on the specific symptoms that you're addressing. It's very different, someone who's having hot flashes versus someone who's having urinary urgency, as an example. So it's a nuanced discussion, but that discussion should start whenever someone is saying, I don't feel good. If a woman comes to me and says, I'm thinking about taking testosterone, what should I know? What I tell her is if libido is your issue, there's about a 50% chance that it's going to help you. If you're looking to other things, we really don't have the data to show that it is going to necessarily be beneficial. There are a lot of women that just say, I feel better on it. I have a better sense of well being. I have more energy. I can't argue with that. And I never would argue with that. I'm just telling people what the science is. And then you're a grown up, you get to make your own decision. But you need to know how to do it safely, meaning not pellets. Pellets have all kinds of issues, including an increase in side effects such as hair growth, acne, male pattern baldness, enlargement of the clitoris, deepening of the voice. Women are not always told that. We also know that with pellets, there's been increased risks of uterine cancer because of the high doses that are not really evened out. So there's a lot of issues. At the last Menopause Society meeting, there was an otolaryngologist, ear, nose, and throat specialist, who was giving a talk specifically about the impact of testosterone supplementation on the voice. And she made the comment that even women who are on appropriate dosages of testosterone are getting lowering of the voice, which for the average woman might not be a huge deal. But if you're a professional singer or voiceover or someone who uses your voice a lot, it is a very big deal. That's not reversible. So women need to know that again, shared decision making. My job is to tell you everything we know and what we don't know. And then you get to decide what you want to do.
Along those lines, there's this big discussion now on the preventative health benefits of HRT. And
Yeah.
I know that the Menopause Society came out with a statement about a month ago saying there's no concrete evidence that says there's proactive
Yeah.
benefits. You've been doing this a lot longer than a lot of the doctors out there. What is
Yeah.
your opinion right now on this
Yeah.
controversy?
So this is the thing, and this is where it gets muddy because we have a lot of data that shows a very strong association with hormone therapy and the impact specifically at the level of, blood vessels. I'm looking at cardiovascular disease and looking at when you look at long-term things that it decreases diabetes and all that. No one's going to disagree that we have data that shows those things. The problem is that the Menopause Society, and they're very conservative, and they are saying, yes, there is an association with women that use hormone therapy tend to have less plaque in their blood vessels. They tend to have less tau tangles in their brain. We have data that shows that. But can you then extrapolate that data and say, therefore, they're going to have less heart disease down the road and be less likely to die from heart disease, and that they're going to be less likely to get Alzheimer's? And so the people who are out there saying, the other side of it, if you will, says, well, we don't have those studies and we're not going to wait for them. So therefore, we should just tell women to use it to prevent this stuff. And the Menopause Society is saying, no, 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 you shouldn't take it for what they call primary prevention, meaning that you're only taking it to prevent heart disease. And of course, as someone who's spent my life straddling both worlds, my approach is I think you need to understand that if you are, as an example, at risk for cardiovascular disease, obviously you need to do every other thing in terms of healthy diet, maintaining a healthy weight, eliminating alcohol, the long list of things for cardiovascular health. And then to say, and if you have hot flashes, bone issues, which we know hormone therapy is going to help long term, then by all means, it's also going to potentially protect you from having heart disease. The hard question is the woman who comes in and says, I have no hot flashes. My bones are amazing. I feel terrific, but everyone in my family dropped out of cardiovascular disease in their 50s. Should I take hormone therapy? And what I would say to that woman is, we have data to suggest that it is going to be healthy for your heart and for your vessels and all of this. Right now, it is not FDA approved for that purpose. However, I am telling you what the data is, and then you decide. People always talk about the WHI being a bad study. The WHI was an outstanding study. It was a beautifully designed study. It just asked the wrong question. The question it asked was, what happens if you give women over the age of 60 an oral estrogen and a synthetic progesterone? That answered that question real well, but it didn't answer the question of, the way we treat hormone therapy, the way it did not answer the question of the way we prescribe hormone therapy now in terms of starting it younger and using different progestogens that are safer and giving a lot of different options. So, it's confusing to women because it's
It
confusing
is.
to doctors.
Right. And I
Right.
would even say, because I was telling Bridget, I had gone to the doctor's recently. I'm not on HRT, Bridget is. And I had gone to the doctor recently because I'm osteopenic. And my fall risk wasn't high enough to do like Evenity or the other bone density shots. So I had two doctors in the room. One was semi retired, brilliant man. One was a young resident who was doing her rounds with him.
Yeah.
And he was like, why don't you start on HRT? I don't have any
Yeah.
other symptoms that were.
Right.
And she's like, no, why don't we wait and see? And they were going back and forth. And I'm like, hello, I'm the patient. Could someone ask me?
Yeah. I mean, right. So to me, that's very straightforward. The data is very clear that if you're trying to prevent the progression from osteopenia to osteoporosis, then estrogen will do that. That's not controversial. We know that it will do it. And certainly you want to do all the other things you already know about
Right.
vitamin D and exercise and all that. But the piece of it that they don't tell you sometimes is that you have to stay on it forever.
Oh, okay.
Because
Okay.
this is the thing. If you have osteopenia and if you are prescribed estrogen to prevent progression of osteopenia, it will do that. And then if 5 years, 10 years, 15 years later, whenever you go off, you will lose whatever bone that you have maintained. You will immediately start to lose bone very, very fast. So that's,
Wow.
again, you have to give people good information. If they're
They
thinking,
didn't say
oh,
that at all.
no, but you
Mhm.
need to know that. You need to know that if you're going to do it, you are really making a commitment.